Good afternoon, everybody. Our project was assessing education, health, and energy needs in rural Tajikistan. I'm Margaret Tarman.
Margaret Taylor. I'm Julia Van Beek.
I'm Rachel Diniega.
And I'm Maggie Orr.
So our project evaluated the need for an education center that our community partner was considering building in the Sari Hasor Valley in Tajikistan. And to that end, we developed surveys and also on education, and also gathered a lot of baseline information on education, health, and energy. So Tajikistan is a little bit off the beaten path, so we thought we'd start with some basic information about it. It's located just above Afghanistan, and it borders China on its eastern side. It is the poorest of the Central Asian former Soviet republics, so the stands, as some of you might refer to them as. It's a ethnically Tajik majority, but there's also a lot of Uzbeks and Russian minorities that are still present there. They speak Persian, so people in Afghanistan and Iran could understand someone from Tajikistan, but because they're former Soviet, they have the Cyrillic alphabet, so they couldn't write to each other. And Tajikistan had a really devastating civil war from 1992 to 1997, and that's really held it back in terms of development. It just really destroyed its infrastructure, and it's such a small country that touched the lives of everyone there, pretty much. Our community partner was called SORTEPA, which stands for Sustainable World Development Within the Environment. They have about to be two science and education centers in the city of Kurgantepe in southwestern Tajikistan, and Kabodian, which is on the border with Afghanistan. The picture there is of their science and ecology lab, which is a really impressive space. The school that they have in Kurgantepe, they revamped from a derelict, bullet-ridden old school building, so they've been able to accomplish a whole lot with a shoestring of a budget. And their relationship with Sari Hasor goes back to 1998. Their co-founder and his father, who were also our drivers for our project, they have been visiting there since Umed was a little boy. And they know basically everyone there, it felt like, when we were there. And our relationship with SORTEPA goes back to January 2012 when I found them over Facebook. So background on Sari Hasor, where we were working and camping for 3 weeks. It's only about 60 kilometers from Kurgantepe, but it takes about 5 to 6 hours to get there because of the difficulties with transportation. It's composed of 14 villages along the floodplains of this river, which you can see. And it's a beautiful, naturally beautiful place. It's all part of a national park, which is a little bit different from how it is in America, but shows you that there's a lot of potential for this in this region for development. And the main problems that our participants in our surveys identified were roads. As we mentioned, you have to drive in the river, along the river for a lot of the time, or if there is a road, it's really dusty and rocky, and in the spring it gets muddy from the floods, and in the winter they have a lot of snow. And those are donkeys under the hay bales as well. And so electricity is a big problem. It's inconsistent if they have it at all. And education, most villages have a primary school, but getting to secondary school is really difficult for a lot of families, so a lot of people drop out. And so our project was intended to address these problems.
So last spring, we worked with the NGO to create 2 surveys that would best fit their needs, but once we got to the field and talking to them more, and after our first few interviews with participants, we revised the survey into one education survey. The first point of the survey was to understand what participants wanted for a potential community education center. We gave them a list of about 15 potential topics for classes at the center and asked them to choose their top 3. The second point of the survey was to understand basic information about the villages that would help SORTEPA create development projects there in the future. So we also asked about health and electricity. On a daily basis, we worked with about 3 to 4 translators, and we visited about 1 to 2 villages per day. When we would arrive at the village, our head translator, Nizora, would ask consent from the village leader, and we always received pretty positive responses from the leaders about the survey. We'd interview about 10 participants per village, and after going to a couple villages, we would sit down together as a group and summarize our data. In total, we interviewed about 118 participants from 13 villages, and when we were aggregating the data, we divided it into the quantitative data, which was the participant background statistics, and the education center subjects, the list of top 3 potential topics into tables and graphs, and then the qualitative data was summarized by topic.
So the main results we were interested in were the results of the education survey. One of the big things we wanted to know was how much education our participants had, because that might affect how much education they wanted for their children. A slight majority of them had completed 10th form. 10th form is the equivalent of 10th grade. Here in the States, each form is a year. You can look at the information up there. 6% had no education. Some participants struggled to write their name on consent forms because they had never written before, so there was quite a range in the participants that we were interviewing in terms of education. But the results of the study that were really important were their answers to the what classes they wanted in the education center. So this is the part where we gave them a list and asked them to pick. And English was the overwhelming majority. Nearly everyone chose English. Health was another big one. We interviewed mostly women. And health was a bigger concern for them because access to health care is really limited, and we have more information about that in the health survey. But the basic first aid was something that was also really desired by the participants. We thought that Russian would be more popular because a lot of young men move to Russia for a period of their time to work and make money for their family. But the participants all agreed that English would be more useful because they wanted to make the place a tourist area because it's absolutely beautiful out there. Some general trends. Most of the people we interviewed were women, and we talked about if this center were built, who would you send to it? And most people replied their sons, their oldest child, or their oldest son. So it all depends on the cost of the program.
As Maggie said, health was a problem listed as when we surveyed women, as well as women said that maternal health was especially an issue since women have problems with miscarriages, stillbirths, infertility, and maternal death in the area, and there's really limited access to health care. That's a picture of a hospital right there in Sari Hasor. It's equivalent to a clinic in America. As well as water-borne illnesses such as malaria, typhoid, hepatitis, and bacterial diarrhea were common in this area, and villagers listed that they have problems with flu, stomach, kidney, and sore throats, as well as anemia, and they use local healers such as medicine men, mullahs even, and midwives with no formal training, as well as herbal remedies. So 91% of the country uses hydroelectric plants to get their electricity, and rural villages also use hydroelectric power. But hydroelectric power is really variable because of water levels. Water levels are higher in the springtime, but really low in the winter and summertime. And they cause frequent electricity loss. So because of this inconsistent power, the government provided solar panels to some of these villages in this area, but they were only enough to power small LED lights. So this was a problem. And so some villages banded together to buy larger solar panels so that they could have more consistent energy use. And hopefully with this new community center, we would help to look into more sustainable ways to get renewable energy.
So there were some limitations to our survey. The first is time. We were only in the valley for about 2.5 weeks, and it would have been good to be there to get to know the community better. With translating, there's always a potential for miscommunications or misunderstandings. Inconsistency we mean by sometimes our participants were alone, sometimes with family members, or sometimes in a group, and that might have affected their responses. Again, like Maggie said, most of our participants were women, and if responses varied by gender, our results would have been different if we had interviewed more men. And then finally, in some villages, there was a small sample size based on who was available to interview at that time.
And our team decided that a centrally located education center would be the best solution to this problem, and it would have a dormitory which would alleviate the geographic limitations of the terrain. And teachers would be picked from the Sword Tepa graduates who we actually got to work with a lot as our translators from Korgan Tepa. And in case children would not be able to come to the center during the school year, they could come for the summer as a residential camp. And in order to encourage women to come, we would teach skills they would teach skills like dressmaking, which is actually a money-making skill, and it would give them a benefit of being away from the home. And the main purpose of the center would be a collaboration for ideas about development and sustainability. And many people feel a strong connection to the Sari Hasor home, so it would allow them to better themselves and better their villages.
So thank you so much to JPC for giving us this opportunity, to our faculty sponsor, Dean Lyons, as well as our community partner in Tajikistan. They were absolutely amazing, Sword Tepa. and our participants in our survey.